In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 25 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 21. Describe a time when you had to work as part of a team to solve a problem. The following are guidelines of how to approach this question. Employers ask this question to assess your teamwork skills, problem-solving ability, and communication effectiveness, which are essential in a community pharmacy setting. They expect you to provide an example where you collaborated with colleagues to achieve a positive outcome, demonstrating initiative, adaptability, and a patient-centered approach. You should highlight your role in the team, the challenge faced, the actions taken, and the result achieved. When answering this question, avoid giving vague or overly general responses that do not showcase a specific example. Strong knowledge of the PSI's, guidelines on the patient consultation process, and the Code of Conduct for Pharmacists is important, as it ensures pharmacists prioritize patient care, communicate effectively, and uphold professional standards in collaborative settings. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In my role as a community pharmacist, I frequently work as part of a team to resolve issues efficiently. One instance that stands out was when we encountered a supply shortage of an essential medication for a regular patient with a chronic condition. My team and I collaborated to explore alternative options, ensuring the patient received appropriate care without disruption. I liaised with the prescriber to discuss a suitable therapeutic alternative while my colleague contacted other pharmacies to check for stock availability. Our effective teamwork allowed us to secure a solution quickly, ensuring the patient's treatment was uninterrupted and reinforcing the importance of strong communication within a pharmacy team. Question 22. Where do you see yourself in 5 years? The following are guidelines on how to approach this question. Employers ask this question to assess your long-term commitment, career aspirations, and whether your goals align with the pharmacy's vision. The best approach is to demonstrate a clear professional development plan, showing ambition while staying realistic and relevant to the community pharmacy role. Your response should highlight your desire to grow within the pharmacy, take on additional responsibilities, and contribute to patient care and service improvement. When answering this question, avoid vague or overly ambitious responses that do not align with the role, such as stating that you plan to leave for a completely different career path. A strong knowledge of the PSI's core competency framework for pharmacists is important as it outlines the key areas pharmacists must develop to advance their careers, ensuring they continue to meet professional and patient care standards. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In 5 years, I see myself as a highly experienced and trusted pharmacist within this community, having built strong relationships with patients and the healthcare team. I aim to further my knowledge and expertise in areas such as chronic disease management and medication reviews, ensuring that I provide high-quality, patient-centered care. Additionally, I hope to take on mentorship or preceptorship roles, helping to train and guide newer pharmacists and pharmacy students. I am also keen on developing enhanced services within the pharmacy, such as smoking cessation support or vaccination programs, to improve patient outcomes. Ultimately, I want to grow within this role, contributing to the success of the pharmacy while staying committed to ongoing professional development and continuing education. Example scenario. I remember when I first started working as a community pharmacist, I noticed a gap in medication adherence among elderly patients with multiple prescriptions. To address this, I took the initiative to introduce a medication usage review (MUR) service, which significantly improved patient compliance and understanding of their treatments. Over time, I saw how these small interventions led to better health outcomes and patient satisfaction. This experience reinforced my passion for pharmaceutical care and service development, and in 5 years, I would like to implement similar initiatives on a larger scale, ensuring that our pharmacy continues to meet the evolving healthcare needs of the community. Question 23. How do you ensure excellent customer service in the pharmacy? The following are guidelines on how to approach this question. Employers ask this question to assess a pharmacist's ability to provide safe, efficient, and patient-centered care while maintaining professionalism. To answer effectively, the interviewee should highlight communication skills, empathy, problem-solving, and teamwork, demonstrating how these contribute to excellent customer service. It is crucial to show an understanding of patient confidentiality, accessibility, and responsiveness when assisting customers. When answering this question, avoid giving vague or generic responses. Instead, provide specific actions that improve patient experience. In Ireland, a strong knowledge of the PSI's Guide to Professional Conduct for Pharmacists and the Code of Conduct for Pharmacists is important as it outlines the ethical and professional responsibilities required to ensure high-quality patient care. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Providing excellent customer service in the pharmacy involves clear communication, active listening, and a patient-focused approach. I always ensure that customers feel welcome and valued by offering friendly and professional interactions, addressing their concerns, and explaining medications clearly. Confidentiality is a priority, so I make use of private consultation areas when discussing sensitive matters. Additionally, I work collaboratively with colleagues to maintain efficiency in dispensing and minimizing waiting times. If an issue arises, I remain calm and solution-oriented, ensuring the patient receives appropriate care while adhering to PSI guidelines and pharmacy protocols. Example scenario. I remember when a patient came in looking distressed because their regular medication was out of stock. Understanding their anxiety, I reassured them, checked for alternative brands, and consulted the prescriber for an equivalent substitution. I also explained how the alternative worked and ensured they were comfortable with the change. By maintaining a calm and proactive approach, the patient left feeling relieved and satisfied. This experience reinforced the importance of effective communication and problem-solving in delivering excellent customer service. Question 24. What do you know about our pharmacy's services? The following are guidelines of how to approach this question. Employers ask this question to assess your knowledge of their pharmacy's services, patient demographics, and community needs, ensuring you've done your research. To answer effectively, demonstrate awareness of the pharmacy's offerings, including dispensing services, clinical services, and public health initiatives. Highlight any specialized services the pharmacy provides, such as smoking cessation support, weight management, travel vaccinations, or medication use reviews, MORS, and how they benefit the local community. When answering this question, avoid vague or generic responses that could apply to any pharmacy. Instead, tailor your answer to specific services unique to their location. A strong knowledge of the PSI's guidelines on patient counseling and public health services is important as it ensures pharmacists provide accurate, professional, and safe care that aligns with national health priorities. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I have researched your pharmacy and understand that you provide a comprehensive range of services beyond just dispensing prescriptions. Along with standard medication supply, I noticed that your pharmacy offers medication reviews, which is essential in optimizing patient therapy and ensuring adherence. I also saw that you provide vaccination services, including flu and travel vaccines, supporting public health initiatives. Additionally, your focus on chronic disease management, particularly diabetes screening and hypertension monitoring, aligns with current healthcare needs. These services demonstrate your commitment to enhancing patient health and accessibility to care, and I would be keen to contribute by ensuring patients receive clear medication advice, adherence support, and health promotion services. Example scenario. I remember when a patient visited the pharmacy concerned about their blood pressure readings at home. They were unsure if their medication was working effectively. Since the pharmacy offered a hypertension monitoring service, I checked their BP, found it was elevated, and discussed lifestyle modifications. I also liaised with their GP, who later adjusted their medication. The patient returned weeks later with improved readings and was grateful for the accessible, proactive support they received. This experience reinforced how pharmacy services like yours play a crucial role in preventative care and patient engagement. Question 25. Do you have any questions for us? The following are guidelines of how to approach this question. This question provides an opportunity to demonstrate genuine interest in the role and engagement with the employer. The best approach is to ask insightful questions about the pharmacy's operations, patient care approach, team dynamics, or professional development opportunities. Employers ask this to assess whether the candidate is proactive, curious, and truly interested in working for them. When answering this question, avoid generic or salary-focused questions as they may make you appear uninterested in the role's broader responsibilities. Strong knowledge of PSI guidelines on continuing professional development, CPD, and the Pharmacy Act 2007 is important as it helps demonstrate a commitment to professional growth and regulatory compliance. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Thank you for this opportunity. I am keen to understand how your pharmacy approaches ongoing staff development and CPD compliance to ensure pharmacists stay up to date with clinical best practices. Additionally, could you share insights on how the pharmacy team collaborates to optimize patient-centered care and medication safety? I am also interested in how the pharmacy adapts to new PSI regulations and integrates them into daily operations. Lastly, could you provide more details on the pharmacy's approach to handling challenging patient interactions and ensuring positive patient outcomes? Question 26. What steps do you take to prevent dispensing errors? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to ensure patient safety, medication accuracy, and regulatory compliance within a community pharmacy setting. The interviewee should demonstrate attention to detail, knowledge of dispensing procedures, and proactive error prevention strategies. They should also highlight their ability to communicate effectively, work under pressure, and implement safety protocols to minimize dispensing errors. When answering this question, avoid providing vague responses or focusing solely on personal diligence without mentioning systematic safety measures. A strong knowledge of the PSI's guidelines on the safe supply of medicines and the Medicines Act 2003 is important as it ensures adherence to professional and legal standards in error prevention. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. To prevent dispensing errors, I follow a structured approach that includes thorough prescription verification, the use of barcode scanning, and the application of their two-person check system for high-risk medications. I ensure that prescriptions are legible, complete, and clinically appropriate by cross-checking with patient history and confirming any ambiguities with the prescriber. I strictly adhere to standard operating procedures, SOPs, and encourage a culture of open communication so that any potential errors can be caught early. Additionally, I actively counsel patients on their medications to ensure they understand the dosage, indications, and potential interactions, which acts as a final safety net. If an error does occur, I document and report it in line with PSI reporting guidelines, ensuring that corrective actions are implemented to prevent recurrence. Example scenario. I remember when a patient presented with a prescription for amlodipine 10 mg, but the pharmacy technician mistakenly selected atenolol 50 mg due to similar packaging. As part of my checking process, I noticed the discrepancy when verifying the drug name and strength against the prescription. I immediately corrected the error, explained the importance of double-checking selections to my colleague, and documented the incident in the near-miss log, as per PSI safety protocols. This incident reinforced the importance of clear labeling, team vigilance, and continuous training to prevent dispensing errors in a busy pharmacy environment. Question 27. How do you ensure compliance with the pharmacy regulator, PSI, guidelines? The following are guidelines of how to approach this question. Employers ask this question to assess your understanding of regulatory compliance, ability to implement PSI guidelines in daily practice, and commitment to patient safety and professional standards. To answer effectively, demonstrate your strong knowledge of PSI regulations, ability to apply them in dispensing, record keeping, and patient counseling, and your proactiveness in keeping up with regulatory updates. Also, emphasize your role in ensuring staff adherence to these guidelines and collaborating with regulatory bodies during inspections. When answering this question, avoid vague or generic statements that do not show practical application. Strong knowledge of the PSI, Guide to Good Pharmacy Practice, and the Code of Conduct for Pharmacists is important as it outlines professional responsibilities, ethical decision-making, and legal requirements necessary for maintaining compliance. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Ensuring compliance with PSI guidelines is a fundamental part of my role as a pharmacist. I achieve this by adhering to good pharmacy practice standards, maintaining accurate patient records and controlled drug registers, and ensuring that all prescriptions meet legal and clinical requirements before dispensing. I also conduct regular audits, ensure that all staff are trained on PSI regulations, and stay updated on any regulatory changes. Additionally, I promote safe dispensing practices, implement robust patient counseling to enhance medication safety, and take corrective actions when necessary to ensure full compliance. I also collaborate with PSI inspectors during inspections, ensuring that all policies and procedures meet the required standards. Example scenario. I remember when a prescription for a high-risk medication was presented with incomplete details. As per PSI guidelines, I contacted the prescriber for clarification before dispensing, ensuring patient safety. Additionally, I used this as a learning opportunity for my team, reinforcing the importance of checking prescriptions thoroughly. I then conducted a compliance check on our dispensing processes to identify any gaps and introduced a checklist system to minimize errors. As a result, we improved our prescription verification process, ensuring adherence to PSI standards and reducing the risk of medication errors. Question 28. How do you handle an expired prescription? The following are guidelines on how to approach this question. Employers ask this question to assess your knowledge of prescription validity, regulatory compliance, patient safety, and problem-solving skills in a community pharmacy setting. Your response should demonstrate a clear understanding of prescription expiry rules, professional judgment, and effective communication with patients and prescribers. Additionally, you should exhibit customer service skills, adaptability, and knowledge of how to handle such situations legally and ethically. When answering this question, avoid simply stating that the prescription is invalid without explaining the appropriate course of action. Strong knowledge of the medicinal products, prescription and control of supply, Regulations 2003 and PSI's guidance for pharmacists on the safe supply of medicines is important as it ensures that pharmacists handle expired prescriptions correctly while maintaining patient safety and legal compliance. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a patient presents an expired prescription, I would first check the prescription date and the type of medication to determine if there are any exceptions under Irish regulations. If the prescription is outside the valid period, I would politely inform the patient that it is no longer legally valid and explain the importance of an up-to-date prescription for their safety. I would then offer to contact the prescriber on their behalf to arrange a new prescription or an alternative solution. Throughout the process, I would ensure that I provide clear communication and reassurance to the patient, maintaining a professional and compassionate approach. Example scenario. I remember when a patient with asthma came in with an expired salbutamol inhaler prescription. The prescription had expired 2 weeks prior, and the patient was short of breath and anxious. Recognizing the urgency, I immediately checked emergency supply criteria under the Medicinal Products, Prescription and Control of Supply, Regulations 2003. Since the patient had been previously prescribed the inhaler, and it was necessary for their condition, I explained that I could make an emergency supply while simultaneously contacting their GP for a new prescription. The patient was relieved, and they were able to collect their inhaler without delay, ensuring their safety while complying with legal and professional standards. Question 29. What do you do if a patient complains about the cost of their medication? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's communication skills, problem-solving ability, and knowledge of alternative options for patients struggling with medication costs. The ideal response should demonstrate empathy, professionalism, and a patient-centered approach, ensuring the patient receives necessary treatment while considering affordability. Additionally, the response should reflect a strong understanding of medication reimbursement schemes, generic alternatives, and patient assistance programs available in Ireland. When answering this question, avoid dismissing the patient's concerns, appearing indifferent, or failing to offer practical solutions. In Ireland, strong knowledge of the HSE's Drug Payment Scheme, DPS, and the General Medical Services, GMS, scheme is important as it allows pharmacists to guide patients on cost-effective options and financial support for their medications. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I understand that medication costs can be a significant concern for patients, and I always aim to provide practical solutions while ensuring they receive the treatment they need. First, I would listen to the patient's concerns with empathy and professionalism, acknowledging their financial difficulty. I would then explore cost-effective alternatives, such as generic versions of the prescribed medication if available. If the patient qualifies, I would explain HSE reimbursement schemes like the GMS or DPS, which can significantly reduce out-of-pocket expenses. Additionally, I would collaborate with the prescriber where necessary to suggest therapeutic alternatives that are more affordable while maintaining clinical effectiveness. My priority is always to balance patient care, safety, and financial accessibility. Example scenario. I remember when a patient on multiple long-term medications expressed concern about the increasing cost of their prescriptions. After discussing their situation, I checked their eligibility for the HSE's Drug Payment Scheme, DPS, and found they were unaware they could cap their monthly medication costs at €80. I helped them apply for the scheme, significantly easing their financial burden. Additionally, I suggested generic alternatives for some of their medications, which the patient's doctor approved. As a result, the patient was able to continue their treatment without financial stress, and they appreciated the support and guidance provided. Question 30. How do you manage controlled drug prescriptions differently from regular prescriptions? The following are guidelines of how to approach this question. Employers ask this question to assess your knowledge of controlled drug regulations, attention to detail, and ability to ensure patient safety while complying with legal requirements. You should demonstrate strong knowledge of prescription validity, record keeping, and safe dispensing practices, showing that you can handle high-risk medications responsibly. Highlight your ability to prevent misuse or errors while ensuring patients receive the correct medication. When answering this question, avoid giving vague or generic responses. Instead, provide specific details about how you handle controlled drugs differently. A strong knowledge of the Misuse of Drugs Regulations 2017 and PSI's guidance on safe supply of controlled drugs is important as it ensures compliance with legal obligations and best practice standards in Ireland. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Controlled drugs require extra precautions due to their potential for misuse and strict legal controls. I ensure that prescriptions for controlled drugs comply with legal requirements, such as being written in full, signed, and dated, with the correct strength, form, and quantity clearly stated. I also verify that the prescription is valid within the required timeframe, 14 days for Schedule 2 and 3 drugs, before dispensing. Additionally, I maintain accurate controlled drug register entries for Schedule 2 drugs, ensuring that records are completed on the day of supply and kept for at least 2 years. Before dispensing, I conduct thorough patient counseling, advising on safe storage, adherence, and potential side effects while ensuring a witnessed supply process where necessary. Example scenario. I remember when a patient came in with a prescription for morphine sulfate that was missing the total quantity in words. Since controlled drug prescriptions must be fully compliant, I politely explained to the patient that I could not dispense it as written and contacted the prescriber to rectify the issue. While waiting, I assessed the patient's medication history to ensure appropriate use and discussed pain management strategies. Once the corrected prescription was received, I documented the supply in the controlled drug register and provided thorough counseling on safe storage and disposal. This experience reinforced the importance of attention to detail and effective communication in managing controlled drug prescriptions safely and legally. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.